Howdy, we're Team Biohearts, and we're here to introduce our device, the Biobelt. Left ventricular assist devices, or LVADs, are devices used in patients with damaged left heart ventricles in order to support the heart's pumping functionality. Today, about 24% of LVAD patients develop an infection in the driveline of the LVAD. Once infected, a patient's rate of mortality more than quintuples in the following year, and they may be more likely to suffer from other complications, such as pump thrombosis, bleeding complications, a longer hospital stay, and need for an LVAD exchange, and a failure to transplant. The associated impacts of LVAD infections are immense, greatly reducing the patient's quality of life and increasing the strain on hospitals as a result of readmissions. One possible method of minimizing the chances of an infection is through careful application of UV light to the driveline site on a regular basis. Application of UV light will cause DNA of the pathogens to become too damaged to function, effectively killing them. This is preferable to the current norm of curative antibiotic treatment, as pathogens cannot become immune to UV light like they can antibiotics, and because this process is preventative rather than curative, meaning that it can help patients avoid the manifestation of an infection altogether. Thus, there's a need for a device that can use UV light to safely and effectively prevent infections at the driveline site of an LVAD.
When analyzing the need statement, a way to decrease pathogenic bacteria around the driveline of an LVAD pump to prevent infection using UV light, and the current research, a set of user needs were established independently and in collaboration with the client. The user needs were established to fulfill two major conditions: functionality and ease of use for the user. The average LVAD user is roughly 60 years old. Thus, it is important to make the device as easy and simplistic as possible for the user to learn and operate. The stakeholders were identified as the major parties that would have an interest in the device. This includes patients, or the users, hospitals, insurance companies, Abbott and the other companies manufacturing LVADs, and third-party distributors. Majority of the needs are associated with the users. It is important for the device to be effective in killing bacteria, safe for the user, comfortable, easy to maintain with long-lasting rechargeable batteries, easy to use, and non-invasive. Keeping the device low cost and safe for the user and the driveline is an important need when considering the hospitals, insurance companies, and manufacturers as stakeholders. Developing the device to prevent the amount of driveline degradation is important for manufacturers of LVADs, as the current designs and materials that they use for the driveline will not be affected by the device. Also, having the device be lightweight and portable will allow distribution and storage to be easier for hospitals and distributors. Fulfilling the need statement, as well as having the device be low cost, effective, and safe, will decrease the amount of possible problems that the stakeholders will face and increase the satisfaction of the user.
The design inputs for our device were all taken from the user needs. Here you can see our 18 design inputs. Each one ends with a UN1 or UN2, and that refers to the user need number from the previous slide. We wanted to make sure that every user need was met and every design input referred to at least one user need. Some of them, however, refer to multiples. This is especially common with user needs 7 and 8, seen in design inputs 12 through 16. 7 was wanting the device to kill infection-causing bacteria, and 8 was making sure that it was safe for the patient. So these two go hand in hand so often. And for these design inputs, we also referred to academic and scientific papers to try to find the most effective wavelength, intensity, etc., in order to make sure that it was both effective and safe. All of the design inputs, however, we made sure that we were quantifying and making them measurable so that the user needs would be met and the expectations for the device were clear. So even comfort level, number 5, that seems very subjective. It is still quantifiable because it is still asking on a rating scale out of 10 for patients who are using the LVADs, how they feel about the comfortability. The only design input that is not directly measurable is number 18, saying it is non-invasive device. However, this is a either or situation where the device is either invasive or non-invasive. So it is still making sure the expectations are clear, and taken together, these design inputs make a very comprehensive framework for the design, with all of the inputs being found by user needs and working with the sponsor or scientific papers.
Our prototype has three main aspects that determine its feasibility and proof of design. Firstly, the dual hollow cylinder provides a space for two functions, providing a safe and comfortable space for the driveline to be while being disinfected, while also providing a secure space for all the components and circuitry involved with the ultraviolet LEDs to rest. Secondly, the door provides the secure packaging of the components inside, while also providing the user and other people around the necessary protection from the lighting inside. Lastly, the belt loops provided at the two sides of the cylinder provide an extra ease of use factor by allowing a customized belt to sit around the user's body while disinfecting in order to supplement the ease of use and mobility.
The drawing of the assembly shows the dimensions of each component of the prototype. There are three views shown here so that each component of the device can be visualized and interpreted. The cylinder is made of two hollow tubes with the inner tube designed to encase the driveline cable. The diameter of the inner tube is slightly larger than the driveline cable to ensure it fits with room for some mobility. The door is slightly thicker to prevent breakage or failure after being opened and closed many times. The top face, shown in the top left view, will have the LEDs secured on the inside of the cylinder and will be shining down onto the patient's driveline exit area. Originally, we came up with a cone design, but discovered that a cylindrical model would be simpler and just as effective. Essentially, the patient will take the device, pop open the door, and place it around the driveline cable, ensuring it is placed in the inner tube, then close the door, turn the device on so that the light is contained inside the walls of the cylinder and only pointing on the areas needing cleaning.
To give a recap of our semester, we have a well-researched design that we formed based on our needs statement through our user needs and design inputs, design sketches, and more, as shown by my teammates who presented earlier. We ordered and received some of the parts we need. We have ordered and received a soldering kit and the batteries. We are still waiting on the UV lights and the buttons that we've ordered. We also still need to order a belt to attach to the device, which we plan to order next semester. Lastly, we have a prototype. Today, we have shown you our current final design and the SolidWorks of the design that we plan to move forward with for the next semester. Next semester, our goal is to build a working product that effectively prevents infection at the driveline site. Our plan is listed in 5 main steps. First, we will test the wavelength and the distance in lab using the UV light and breadboard kit we ordered to ensure the wavelength and distance is effective at killing the bacteria. Second, we will make adjustments to the design, like the distance the light is from the skin, and order parts as needed in case we need to change the wavelength or we are missing parts. Third, we will 3D print the SolidWorks design and build the device. Fourth, we will test this updated device to ensure the design is effective and still adequately kills the bacteria. Lastly, we will make any final adjustments needed and finalize the device. Once we've completed these steps, we should have met our goals and we will be able to present a final product. Thank you.